Welcome to the Prepperverse, where we explore the art, science, and philosophy of preparedness. Welcome, my name's Doc J. Mo. And today, on this episode, we're going to be talking about medication disaster plan. What it is, and do you have one, do you need it? So today we're going to be talking with my son Micah, and we're going to give you a lot of good information. So buckle up. It's going to be a good ride. Very, very necessary. So, Micah, tell us a little bit about yourself. A little bit about your credentials and your background.
Yeah. Hello, everyone. My name is Micah. So you might be wondering, who are you and why are you qualified to talk to me about medications? By trade, I am a registered nurse. I actually have my master's in nursing informatics, and really the focus of informatics in my master's program, informatics is just a fancy way of saying data analytics, big data, statistics, and quality improvement. So I have my master's in nursing, and before I started working in informatics, my main nursing roles were infectious disease. So I worked on an infectious disease unit for a while, intensive care, and I also did long-term acute care, did some wound care, and worked in the emergency department for a little bit. Before my nursing career, I actually was an EMT and a volunteer firefighter. So I have some pre-hospital experience there.
A lot of medical, for sure.
Yeah, so that is, those are my credentials.
The nice thing I like about his resume, when it strikes me as most importantly, is the long-term nursing. Usually in acute care, you can get somebody stabilized pretty easily, but we usually lose after a trauma situation people in the long term. You can get them stabilized, but you need to keep them alive, and that's a valuable skill set to have, is that long-term acute care. So that's one thing that really has impressed me about your education, about doing that. But go ahead and continue.
Really, that's about it for my qualifications. Where this video stems from is, as I would watch a lot of YouTube channels based around prepping and other medical YouTube channels, I would see a lot of common themes in the comment section about, I can't, if I need to bug out, I can't, or, I have this chronic illness or this health concern that's keeping me from either preparing or keeping me from not only preparing with your medical equipment or medications, but also physically. So I took a lot of those comments and I actually made a Word document out of them. And I thought someday I might be able to use it for graduate school. So I did use it for graduate school in a few different papers that I wrote. So I went back, scalped a lot of those topics from community emergency classes that I took, community health classes, and then some community psychology classes, and kind of consolidated a list which I think is going to be pretty general and a pretty much a cookie cutter type of set of bullet points. Right. And it's going to be pretty general. I don't really cover specific health issues such as diabetes, or dialysis. Those are pretty specific. We might cover those in an upcoming video.
So you're presenting more of a generalized plan for disaster regarding individuals' medical conditions and their prescription drugs, how to kind of manage type thing.
Correct.
Which is something that a lot of people don't consider to the full extent that they should, and they're actually cut themselves a little bit short. So this is going to be really good.
Yeah, exactly. This will be a pretty generic list. I know there's people that'll probably see it and be like, oh, this doesn't really apply to me because I have so-and-so disease, and that's okay. Hopefully you can get a little something from this video. But even for the people that have some general health concerns or are on long-term medication, hopefully this will spark some ideas in your head on how you can prepare. And I mean, not only for like a grid down situation, but even for a if you're in a hurricane zone or any kind of natural
where you have to leave
disaster.
your home for an extended period of time.
Exactly.
Yeah.
So hopefully this will help a little bit.
So introduce us to your plan.
Yeah. So in general, this is just a piece of the pie when it comes to preparedness. Really, it's an important one.
Yes.
And it's one that's really not, it doesn't take a lot of forethought or a lot of effort into thinking about these things and really getting a general plan made up. So I put together 5 points, and the first one is very straightforward. It's make a plan. Start writing down your health concerns. It can be whether it's just your
glaucoma,
high blood pressure, and take those ideas and think about them in a way that you would need to address them if you didn't have access to a pharmacy or medical care. Write down your thoughts and take them to your primary care provider and say, hey, these are kind of my thoughts. And it doesn't have to be necessarily a disaster scenario. It could be, hey, I'm going to leave the country. Sometimes it can kind of be a disaster if you leave the U.S. But and say, can I get your thoughts on how I can go about if I run into issues getting my medications overseas, or can I get some extra meds to take with me? You don't have to name it like an emergency supply of medications, but you can pick your primary care provider's brain. And it's not, don't think of it as them being like, oh, well, what do you need this, emergency stock for? A lot of people will do it. A lot of people go with health conditions, travel out the country, whether for work or just vacation. And so it's something that's very common that that doctors and primary care providers talk about with their patients. So my first point is make a plan and talk to your provider about it. Especially if your medication has special shipping or electronic equipment requirements. You'll want to bring that up, and
such as like refrigeration, storage type.
Refrigeration, storage. You could even apply it to like a CPAP if you need a CPAP as well.
Have extra things on hand for that.
Okay. And for your plan, ask your provider what medications or dosing schedules can be altered in a situation where medication refill times may be extended. For the folks that were in the Kentucky tornadoes, a lot of times the
pharmacies were down.
Yeah, the pharmacies are going to be down. So you need to ask your provider about that. And it doesn't hurt to make a list of other pharmacies that are in the area that will be able to fill your prescription as well. And then you can also ask for a list of similar drugs that can be used as substitute medications in the case that your current drug, the current drugs you're taking are unavailable.
That's a very important point too. If there's any type of a supply chain disruption, and like we saw not too long ago, there's certain drugs that you really couldn't get. There was because they were sitting off the coast somewhere, and so you need to know the different alternatives. You discuss that with your physician, see what he can do, but know and have them written down, not just on your phone or on a computer. You want to have them written down and kept in a safe place, because if you need to take them with you,
correct,
of the different types of alternatives that you're able to take or to supplement if you don't have that, because it's very, very important.
Yeah,
that's an excellent point.
And there's great templates out there. If you just Google medication regimen template, there's plenty out there where it has a spot for the drug name, your dose, and all that information. You can get that. And as well, if you're in maybe even like in a grid down situation to where if you don't have maybe access, if you're on a certain beta blocker, and you run out of that medication, and then hey, your neighbor Bob also is taking a beta blocker. It may not be the same one, but you need to know. You can always ask your provider for a list of alternate medications. Say, hey, if I don't have this beta blocker, can I take this one? Would that be appropriate for me? my condition? If so, what dose should I take? How often? That way, if you have that scenario, you know how to act on that.
Yes.
And then also, if you have another example, would be if you're let's say the lights go out and we don't have access to pharmacies, you start running a fever, you're like, oh, I don't have any acetaminophen, but then in your closet you have Tylenol PM to help you sleep, and that has acetaminophen in it. So it's important to get a little more familiar with your medications, and then
know what you have, know what they're for, and the different circumstances. I will mention this real quick. There is a really good resource, a book that I could highly recommend. I had it when I was going through school, and it is it's called the Merck Manual. I don't know if you can see that there. This is an older edition. However, it lists many different types of conditions, and it tells you the signs and symptoms. It tells you the treatment. It tells you the prognosis of such conditions, and some things that you can do. So it's a very handy resource to have, physical, not just on your phone if anything happens, that you can refer to and check out and see. It's very much a valuable resource. I would highly recommend that. And then, like we were just saying, get familiar with the medications that you have on hand, and talk with your physician, talk with your nurse practitioner or nurse at the hospital that knows medications pretty well. Because if you are having to rely on certain medications that you're taking, you're going to need to have a certain supply in the event that something happens. But once again, you're putting forth the forethought and planning in the event that something out of your control happens. At least your health will be keep it status quo.
Yeah. So that's point number one. Make a plan, talk to your provider, start thinking about these things. You don't have to necessarily have a full plan to take to your provider. Just have a couple of thoughts.
Start a discussion. Just start a discussion. What if this happens? What do you recommend that I can do that I won't be caught flat-footed somewhere without what I need, whether I'm out traveling out of state or
exactly
my house washes away, whatever you want to be
supply
able to.
chain issues, right?
Yes.
So point number 2 is keep an update list of your medications, which hopefully everybody does anyway. But medications do change from time to time. Sometimes insurance carriers will say, hey, we're not covering, this drug this year. You're going to have to take this other one.
And it's always a good thing to do. If you make that list up, you take it to your physician, because a lot of people have a polypharmacy. I mean, they have a lot of different medications from many different physicians. And sometimes they don't necessarily keep up with everything. They're not current on, because you don't see them all the time, and things change, and one physician may not be aware. Keep that updated to your primary care physician. Take that and show them and discuss it. Say, listen, this is everything that I'm taking. Take responsibility for this, because no one's going to do it for you. You have to do it yourself.
Yeah.
So have them look over and say, is there anything on here that I can reduce? Is there anything on here that maybe that I need or don't need? So just have that discussion with your physician, because that's very important.
Yeah. And once you get a plan down and you get comfortable with your plan and your medications, it's not a bad idea if you have a loved one. We saw this in the hospital all the time. We called it polypharmacy when we would get, usually it's common with elderly patients, but they would come in, they would have a bag full of medications, and it's like, you have not kept the greatest list. And they'll have expired they have
it's a nightmare.
Multiple drugs for the same condition. So it's not a bad idea to go over it with them to get more familiar with their medications. There might be medications you share. You might be able to, if there is a supply chain shortage with pharmaceuticals, you might be able to exchange. But the key is talk to your provider, because you need to make sure either that they kind of give you the green light, or they check off and say, yeah, in this situation, you can take this, because it's going to be different dosages for different.
Right. Make sure you have that current list. Like I said, because you don't want to get into like a worst case scenario where you have no access to any type of healthcare at all, and then be taking some medications that maybe you shouldn't be taking that you didn't quite sort out ahead of time, and those medications making you more sick.
Or drug interactions.
Or drug interactions, yes, absolutely. So be current on that and keep up. It's your responsibility.
Right. And then also it might be, it's beneficial too to talk to your provider about potential off-label indications for drugs or off-label uses. You might...
Give an example. Ivermectin is a good example of that. We've seen it in COVID recently, off-label use.
Yeah, it is a protease inhibitor, so it will slow down viral replication, and that's a whole nother battle. Like, does it work? Does it not work?
Right.
If you're so inclined, go do some. You can pull up. Luckily, Google Scholar isn't super censored, but you can pull up some articles and kind of use your own judgment there. Yeah. All right, so that is point number 2. Make a list of your medications. Point number 3 is how much medication you have on hand. So if you have medication left over, maybe from one dose, you didn't quite use it all, ask your primary care provider how you can properly store it and reserve it, and then how long it will last as well. You can also, it doesn't have to be a planning for the end of the world. You can use this to, if you know bad storms are going to come through, you're going to have a snowstorm, there's power outages in your area, you can go to your pharmacy, and you can talk to your provider, and then go to your pharmacy and pick it up by getting an emergency dose of your medication, especially, it's important for more of your vital medications that are keeping your heart beating. We've seen, I know in Texas, there's a few providers I know of who were being more proactive and saying, hey, we know,
this is coming, this hurricane's coming, or
let me give you
snowstorm.
Let me give you some more medication. So if your provider isn't proactive about it, definitely ask.
Keep on them.
That's right. And then so that's point number 3. Point number 4 is ensure that you have the proper storage for your medications. Place the medication bottles or packages in watertight containers. If there is a possibility of flooding or water damage, or you're moving them around, you put them in your bag. It's good to have them stored the proper way. And also too, if you do have medications that require a colder environment, make sure you have maybe some ice packs in the freezer and then something to throw it in, so you can ensure that you can keep that medication at the appropriate temperature that it needs to be stored at. And the last point is alternative pharmacy locations. I know we kind of talked about this a minute ago, but you want to ensure, and actually some of the information on this point I pulled from the Centers for Medicare and Medicaid Services. They had a great article that I actually used in graduate school. So a little bit of this information comes from there. You want to ensure that you have a list of pharmacies within a 50-mile radius of your location. So that's actually a recommendation from CMS. And then it's also good to have a list of pharmacies not only within the radius of your home, but also if you plan on keeping medication stored off-site or at a bug-out location, you want to see if you can get a list of pharmacies around that area too, in case you do have to go to your location. You want to be able, well, maybe at that point pharmacies won't even be around, but it's good to it's good either way to have a list.
It's good to have that knowledge.
That's right. And then an extra layer of protection would be to keep a small stash, whether it's kind of leftover medicine you haven't used. You can always use an extra emergency like dosing if you have medications that you use. You're like, we know tornado's gonna be coming through. I'm gonna go get some extra medicine from my provider. You end up not using it. You can keep a small stash of cannot live without medications at your bug out location, but it's important to keep track of the quantity of that medication and probably most importantly, the expiration date. A lot of medications can go past their expiration date, so that's another question
Their
you might want
potency
to ask.
drops after a certain period of time. It kind of drops
Correct.
down over time. So
Correct, yeah. And that's another talking point you might want to have with your provider.
Yep.
How long past the expiration date is this medication effective, and how long can I take it? Some medications you probably don't want to take too far past their expiration date, but some are absolutely okay to take. But definitely have that conversation with your provider. And that is my last point. It's a very generic list. I tried to make it as boiled down as possible. I know there's probably going to be people that are like, well, my disease process, I still can't do it. If you're on dialysis, you're pretty limited, unfortunately, on what all you can do. There are steps you can take, whether it's a diet altering type of strategy where you can change your diet, get rid of phosphorus and urea out of your diet, and then take your medications on a certain dialysis schedule. And then we can do a video about dialysis and like LVAD and diabetes at some point.
Yeah, because this is all really, really good knowledge to have. And as a prepper, you're going to want to consider these things. And this kind of topic you don't hear out there a whole lot. So we plan on getting to a little bit more detail as we go along in this series, in the medical series.
And really the purpose of this video is just to get your mind
thinking in that direction. Start thinking ahead, because like I said before, we may not necessarily have the luxury of time to get these things. So the sooner that you can get your medications in order, have that healthy conversation with your physician, discuss with him or her all your concerns, and even give some examples of an event that, going out of town and you lost your medicine bag. What do I do? So just voice all your concerns, because those are very important. It's very important, very good topics to bring up. Well, did you have anything else that you wanted to bring up?
No, I think that is it.
Well, thank you very much for bringing this knowledge and starting this conversation, and we'll definitely follow it up with another videos. If you have any questions, please just add them in the comment. We'll do the best we can to get back to you. So anyway, all right. Well, thank you for joining us here at the Prepperverse, and we will talk to you later.
Thanks, everyone.